Clips, clips, fun clips, up clips. Welcome to the clips, where the fun never ends. We'll dive into topics, make new best friends. So grab a seat, get ready to go. On the Clips Podcast Show, let's enjoy the flow. Ain't nobody messing with my mind. We'll discuss the latest trends and news. Laugh and debate, leave you feeling amused. Ooh, yeah. Tim, the man is your host. Keep the energy high, we're introducing stories that will touch the sky. Let's talk. Let's talk. Welcome to the Clips, the place to be, where no topic is too controversial. You'll see, join the man Tim, let's talk for a while. On the Clips Podcast Show, we'll make you smile. Clips, 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 clips. Welcome to the Clips, where the fun never ends. We'll dive into topics, make new best friends. So grab a seat, get ready to go. On the Clips Podcast Show, let's enjoy the flow. Ain't nobody messing with my mind. We'll discuss the
All right. Welcome out there in the I was about to say TV land. What land is this that we in now? What would y'all say? We on internet land,
Universal.
Planet Mars land, get with it land. Welcome to Clips Podcast Show, y'all. What does it say? Like, subscribe, share. I don't know what it is saying on my end. Tune in to the show. We got a good show tonight. We got more of a educational show tonight, where we got a guest here, Purple, who can help us out in a lot of areas that on the education side. Good topics. Y'all be giving me pretty good topics to use. And me and Mr. Davis, I can't say Mr. Davis has done everything in the world. So I can't say he ain't done this. So we'll go ahead and bring the video on in, and then we'll discuss what we want. And that's what we do. We'll discuss, and you can help us out. This is for you people out there in the world. I know y'all going through this, and if you want to chime in, I think I got the live chat working. Give me your opinion, because the questions I'm gonna ask, I can't answer it, but Purple probably can, and Mr. Davis probably knows somebody who probably can. But we'll get y'all, and maybe some of our other people will come on and help. But let's go in and check it out.
Working on the front lines at Northeast Ohio hospitals can, of course, take a mental toll on the healthcare workers, especially as we see those COVID-19 cases continue to rise. Our Brandon Simmons details how things have changed and what's being done now to protect them.
As Ohio nurses treat patients sickened by coronavirus, one thing they're learning is that things change quickly.
1 minute he's short of breath, he's on 4 liters. The next minute he's on a vent. The next minute he's getting life flighted down to main campus.
Selena Harrison is a nurse for University Hospitals and says seeing COVID-19 cases here at home makes the job more stressful.
I know for myself, I'm kind of anxious, just because they say right now in Ohio, it's the calm before the storm.
Videos getting traction everywhere online show nurses all over the country who struggle at times to cope as they walk into high-risk situations every day, but continue to do so anyway.
Safety for me is, priority as well, but it's mainly my family. I don't want to bring anything home to them because they didn't sign up for this. I did.
Brittany Reeves pulls double duty at Cleveland's VA Hospital and Lake Health in Willoughby, leaning on her faith to get through each day.
It is nerve-wracking, though. It is scary. I really just try to pray and talk to my fellow coworkers and talk to my family about my feelings.
Supporting our healthcare workers is more important now than ever before. To help, university hospitals and Cleveland Clinic set up special support lines for workers, and Metro Health is adding additional telehealth sessions to support its staff.
If I don't take care of myself, I'm not able to take care of anyone else. So we have to take care of our medical staff and ensure that they are at their best so they can provide the best care to our patients.
But nurses say you can help too by doing the right thing.
Really take care of yourself and help to take care of others by doing what is asked of you. Stay home.
Just let us do our part to take care of you guys, and you do your part to take care of us.
Now, if you're a healthcare worker who needs someone to talk to, do not be afraid to use these resources. As we've said since the beginning of this pandemic, we're all in this together. I'm Brandon Simmons, 3 News.
Well. What do y'all think about that? My thing is, you familiar with all that. What do y'all think about the COVID-19 disease in a nutshell? What do you think about it?
If you asking me, I believe it's man-made disease.
You think it's man-made? It's not a natural disease?
No, a lot of these diseases are created in a lab. Somebody's experimenting with something and then it gets out of hand and boom, there it goes. But it was like an extreme version of the flu. Because now it's literally like it's part of our flu season. Like right now, it is literally part of flu season. But at that time, a lot of people, their bodies had not built up an immunity to it, so it was killing people whose immune system was not strong enough. Right. And I mean, it's really sad. It's really sad that it happened. And we didn't know how to deal with it, how to cope with it, and I dealt with it for maybe the first 6 months, and I stepped down.
Right.
No, I stepped down. And when I
stepped
down, I went home.
Oh, did you ever get it?
Oh, I've had it 3 times.
3 times?
Yep. I had it 3 times. All 3 times I got it from work.
Mm-hmm.
Yeah. But for me, it was not as bad as some people's. Like when my daughter got it, her cough, her pulse ox, because she had a compromised lungs. I was worried about her. For me, it didn't do what it did to a lot of people. I still had my taste. I had my smell. I would not have known if it wasn't for me knowing my body that I actually had it and needed to test myself. Like literally, I felt strange. Like, and it's an odd thing to say. Like, I literally felt strange. And so I told me, you know what? Go test yourself. I didn't have a cough. I didn't have a lost taste of smell. I didn't have anything. I felt strange. I felt different.
Mr. Davis, did you ever catch COVID?
Yeah, I caught it probably the same way she did. I caught it a couple times, but I didn't lose the taste. I didn't lose none of that other stuff.
What symptoms did you have?
I had the symptoms. The first day I was weak.
Oh,
but I think the biggest problem, like she said, when it first came out, I was in Georgia, and they was treating it kind of like an upper chest infection. They didn't really know what the fuck it was, but I believe it was man-made because it comes out around the time when they start talking about it's too many people populating the earth. They do shit as only the strong go survive, so they put that shit out here in the world, and whoever get it, hold on to it. Whoever don't, let it go. When you look at those nurses, you have sympathy for them because, they work in the field where people come that get sick. But shit, COVID was so bad, it was everywhere. I'm talking about you go to any job and you got people that's healthy enough to come to work, but they in that motherfucker had the same sense. And I think everybody else had the same danger of taking it back home to their families at home, more or less, than it was actually worrying about your safety because that's your job.
Right.
You know what I'm saying?
I was gonna say, Purple. People that had like health problems, they were affected the most, opposed to people who, was in good health.
I honestly, I mean, from what I saw, I feel like it was a twin cost. Honestly, you had people who had weaker immune systems that were affected extremely, but then you had people who had never. Pregnant women who never had anything wrong with them, who were, like nurses who had never had anything wrong with them prior. They were grocery store workers, like you said, it affected so many people. It wasn't just the weak being knocked out. Yes, they publicized it as, oh, if you have these conditions, that conditions, you're more likely to have these issues. But literally, it was hurting anybody and everybody it could get a hold of whose body had never been exposed to it. And it didn't matter whether you had diabetes or you were overweight or whether you were just a normal person who never had anything wrong with you and you were on a ventilator. I literally seen people who literally had never had anything wrong with them ever in their lives on ventilators, just as well as those who had, you know, severe health conditions. Now, are you more likely to have issues because of pre-existing health issues? Yes. I mean, yes. That's literally, that's scientific. I mean, that's science working. Yes. You're going to be more likely to have more health issues. But were there people who had never ever been affected, being harmed by this? Yes.
Now,
But when you look at a country that's over 70% of the people here is obese. Then
you know, unhealthy, obese,
you're
and
just
unhealthy.
you're dropping it in the water.
But the country that it started in, what really makes me amazed by this is the country that it started in, which is China. Most of those people are healthy, fine, like, you know, they're in shape. They're intelligent, in shape, healthy people. Hi, and they were dying over there just as equally as we were. So for them to put.
So to say the things that you're saying, could you get the people out there like a little bit of your background? You ain't got to tell them what your IQ is. Just tell them.
You talking about me?
Yeah. Yeah. You
said you don't got to tell them what your IQ is. I'm a registered nurse.
Okay, so when
COVID happened, I was a licensed practitioner nurse. I've been in healthcare for 20 plus years. Yeah, I'm a registered nurse.
Well, I just wanted you to say that so people won't think you're just talking, you know, out your glasses or something. You do know what you're talking about.
Coming out.
Yeah, this is what you do. So yeah.
Yes,
so,
it is what I do.
Right. Monique, didn't you was you in the field at one time? The medical field, or before you went in the field you was in?
What'd you say? I couldn't hear you.
Were you ever in the medical field before you went into the field you are in now?
No, I'm trying to go into the medical field now.
Okay, which one? Give us which one you're trying to go into. I'm saying, you know, like which branch? Ain't it different branches like RN, LPN, this end, that end?
Well, it's levels. You got to start at a certain level.
I'm trying to go. I'm trying to be an LPN. I had to start with being a CNA first, so that's why y'all haven't been seeing me.
Okay. Right.
So got that taken care of. Now I'm in the program to be an LPN.
All right. Well, you got Purple here. She could give you some insight. She pretty good with this stuff.
I don't walk all the walks. STNA, no, seriously, STNA, MA, LPN. I'm a registered nurse, and I'm on my way to become a nurse practitioner. So I've walked all the walks.
So you could network, and she could give you a direction to go there.
None of them are easy walks. I will say that. None of them are easy walks from an STNA. They listen. Matter of fact, when I became an RN and when I got on the floor and they asked me like, you know, well, what can we do to make your day, you know, to make sure you have a good day, this, that, and third. And I told them, I said, give me a good aid. Okay. And they looked at me crazy because behind every good nurse is a fantastic aid. If your assistance is not up here. Baby, I can't even give the kind of care I need to give if I gotta do my aid's job. If my aid is not there, baby, my aid. I mean, just like a doctor.
You gotta call me and Mr. Davis. We good aides. We could have been aides.
Just like a doctor needs his nurse, a nurse needs her aid. And listen, there's some champions out here, and I give a STNA, baby. You have to give them their props, and I don't.
Hey, Monique. I'm sorry. I asked the question before you came on. How what do you think about the COVID-19 disease when it came out? What is your take on it when it came out?
Oh, Miss Purple, I'm gonna make you mad.
Uh-oh.
I'm so sorry in advance. I know y'all doctors was up there killing people, not knowing what y'all was doing half the time.
You said who was killing people?
Y'all doctors was up there killing people. not knowing what they was doing. So just a little background, right?
They ain't know what they was doing up here.
Let me just a little background, right? During COVID, I was I'm gonna say a janitor. They ain't like us to use the word janitor, but I was a janitor at a couple of clinics.
Environmental aid. Say it right.
That's
What is
yeah,
that?
yeah, right. That's the word they want
can
us to use. Environmental
Wait a minute.
service. I was a
Monique,
janitor.
Can you dumb that down? I don't want to use the word dumb. Can you bring that down for us to make everybody understand what that
Man,
is?
you don't know what a
Everybody here
janitor
watching.
do, man.
No, she said no, I don't know what a janitor do.
That's why I ain't use environmental service because that sounds like
Okay.
something else. No,
That's what I
janitor.
thought.
That's
Come
the
in, clean up
word
the
for-
spills, take the waste
for
away,
it.
all that shit.
Yeah,
Okay,
push
all
that
right.
away. But I was
Okay.
working in a
Well,
clinic,
people
right?
already don't know, so I got to for the people. Go ahead.
I was working in a clinic. I can't reveal what clinic, but I was working
Okay.
in a clinic. It's a very known. North Carolina has 3 very known hospitals. If you know anything about North Carolina, then you know their hospital systems, and 3 of them are big ones. So I was working for one of the big ones. It's a team named after them too. That'll give y'all a little hint. Okay. So I was being nosy one day because I had to clean all the doctors' offices and stuff like that. And one of the doctors had his email left open, like he printed some things off his email and it was sitting on his desk. And I wasn't supposed to be nosy, but I was being nosy. And in the email, it was an email that went out to every doctor in America, basically telling doctors that they were about to kill a whole lot of people because they were dealing with things that they had no knowledge of and no experience of. So he was cautioning doctors to, instead of doing what you're told to do, go back to what you were taught to do.
Go back
But
to
a lot of doctors were not doing what they were taught to do. They were doing what they were told to do. So there was a lot of people getting killed and dying at the hands of doctors when they had regular illnesses like pneumonia or the flu or a common cold, because at that time, common colds, flu, and pneumonia, all their symptoms aligned with COVID. So people were being put on ventilators and respirators that didn't necessarily need it just because of that.
No, you
So
said
was
they
was the doctors killing people or was the hospital administrators killing people?
The hospital administrators
at the end
don't
of the
put no tubes in nobody's mouth.
I mean, yeah, the doctors make a decision, but
the doctors should, like that email said, go back to what you have learned and what you know, not what you're told. A lot of people was doing what they was told from the CDC instead of doing what they know. You know what a common cold looks like.
And watch this.
What the flu look like.
Yeah, but if you don't follow those rules from the CDC, your ass get fired.
Well, I would say we're listen, Monique. I'm telling you from all the seats I done walked, because this is I'm on number, I don't know what job, because I don't conform to what everyone wants me to do because of what you just said. But you will learn that when it comes to feeding your families, everybody don't have the luxury that I have of, saying, you know what you talking about? My life is more important. I took an oath to do what I'm you know what, by to what you saying. Those doctors, some of them didn't, unfortunately, some of them didn't have a choice to.
I mean, I get
what you're saying.
I'm a firm believer of your moral code comes before any dollar. That's just me. I can't speak for nobody else. But if you ask me to do something that does not represent the godliness in me, I'm not about to do it. I'm not about to do anything that's going to hurt.
But like you said, they didn't know. They didn't know. Right. Yeah, somebody's telling you, sending you an email saying these things, but they didn't know if the CDC was wrong or what this email this doctor sent was wrong. Did they? Who to say? The CDC was wrong.
Hey, Fauci was saying it, so we had to do it.
Right, like it's like, but I mean, my thing is, who was truly wrong, and it's literally like the Libra scale. You don't know who's wrong until
Libra's always wrong, but that's what we counting on. Libras ain't never balanced, even when they say they balanced.
I mean, but it wasn't, and it wasn't balanced. It wasn't balanced in what they were doing. A lot of people died.
So let me ask y'all that. So let me ask you my very first question. So how stressful is it really to do, you know, in the healthcare as a healthcare worker in these days today? How stressful is it to be, you know, in this workforce as a healthcare worker?
Very.
No
The
matter,
burnout is high. Burnout is super
yeah, that's what
high.
I wanted to know.
I've
Yeah.
literally, I've stepped back from, I don't do bedside nursing. As of September 8th of 2025, I don't do bedside nursing anymore because the burnout rate is so high. Like I do infusion nursing right now. Like the infusions that you want for MS and brain and things like that. That's what I do now. I stepped away from bedside nursing because what I just was experienced with, like what you just said, you know, somebody telling me to do something that I know is wrong. You giving me 9 patients with legally only 6 are appropriate. You know, you want me to make decisions. I'm sitting here watching my CNO, my chief of nursing, make decisions that I saw a man lose his life behind. And that was the last decision I was ever going to watch somebody who was in charge of me make, and somebody lost their life behind.
So they lost their life because you was just doing what you was told?
I had no parts in it, but watching that CNO tell people what to do, what not to do. You in there trying to run a show that you should not be running. You don't even work on the floor anymore. Your floor nurses, this is where I say, you know, when it comes to hierarchy of things and who needs to be doing things, the chief of nursing, you run the background of things, but when your floor nursing has the BLS, their job is to run cold blues. This is what we're supposed to be doing. We put the pads on patients. We do CPR. Why are you in here when all you do is push papers and you are in here making a choice on a man's life and you holding the pads, literally holding the pads in your hand?
That actually brings me to my next question. So, and Monisa, this might help you out with the path you want to go. Whose job is more stressful? STNA, RN, LPN? Whose job is the most stressful?
The one at the bottom of the ladder.
From what I've been told, from what I have been told, I don't know, Mr. Davis, what you're talking about, but with me having to visit all these different clinics and hospitals and things that I've been having to do lately, from what I have been seeing and have been told, nurses have it the hardest because they have to make harder decisions.
I thought they had it the easiest because they tell everybody else what to do.
At a hospital, the CNA has the easiest job.
What to do.
At a hospital, the CNA has the easiest job.
Lies. First of all, this is how can you tell me a
CNA has the messiest job? CNAs have the messiest job.
And don't get paid shit to do it. So if that ain't stressful, the motherfucker, I don't know what it is.
Mr. Davis, I have climbed every ladder, and I said that for a reason because I've walked every walk of life. CNAs have the messiest job. But when it comes to the hardest job,
messiest or hardest?
The messiest.
Because his question was the hardest.
Deal with shit to throw up. But
his question was the hardest.
And I'm trying to get
What's the most stressful? What's the most stressful?
The most stressful is the nurses because we have to talk to the doctors. Listen, Mr. Davis, you don't work in healthcare. Listen.
I worked in a psych ward for 15 years. Let me tell you something. Listen.
That ain't medical though, is it, Mr. Davis?
What the fuck? What do you think psych is?
But he's not listening.
No, but all I'm saying when I say not listening, this is all I'm saying. Hold on. Understand my argument. Nurses, RNs make over $100,000. STNAs make $15.
We don't all make that, but believe.
Okay, but y'all ain't making $15 an hour.
Believe what you.
And the STNAs
an hour don't equate to $100,000 a year.
No, you're not listening. I said STNAs make that.
I don't know if there's a difference because Ohio might have a different name for it, but down here where I'm at, CNAs don't make no $15 an hour.
Well, okay, so what they make?
I was making 20 plus.
I was about to say a lot of CNAs starting out.
But you know so much about healthcare. You're not letting the people who work in healthcare talk.
No, we talking about what's stressful. At the end of it, I'm just asking this.
Wait.
When you talk about a person's stress level,
the most stressful.
And when you talk about it, it all depends on the person. Because if you working, like you said, if I'm doing the cleaning up the mess, the biochemistry, all that other stuff, and my check ain't nowhere near the other people that's making decisions around me, but I'm working twice as hard to clean up the mess, or I'm sacrificing my whole time to get. I'm playing in germs, bro. You understand what I'm saying?
We all playing germs.
Yeah, I think everybody.
We all playing germs because I'm playing in blood. I'm playing in blood and body.
And they cleaning the blood, but they clean. At least you know. At least you know what you playing in. At least you know what.
We wipe ass too. We wipe ass.
Hold on.
At least as nurses. At least as nurses, you know.
Hold on, Monique. Let him finish.
You know what substance. You know what you playing in. You know what can seriously harm you. You know if this touches skin, this can. You know what damage it can do. The average STNA don't know a damn thing about what they clean. They just cleaning it up.
That's not true.
Okay,
let me hear what she got to say. Let me hear what she got to say.
Okay, talk to me, Monique. Talk to me, Monique.
That is far from the truth. In my classes, I had to learn everything.
I'm listening for shoot a couple of them out there.
So, in my classes, you had to learn the same. You have to learn about the same exact thing. Any type of fluid, any type of anything that comes from a human body, you got to be aware of it. There are certain chemicals that we cannot touch. There are certain things that we cannot do that only nurses can do, that only LPNs can do. But what I was getting to was when you were saying what you were saying, not every, I say CNA down here. I don't know what STNA.
It's the same thing. CNA, STNA, the same thing.
Okay, I was about to say, I don't know if they're the same things, if they got different names in Ohio. No. But down here and in North Carolina where I was at, you got different levels. You have CNAs that work at psych wards, like Mr. Davis said. You got some that work in long-term care facilities with the old people. Them the ones that clean shit that you talking about, Mr. Davis. Then you got the ones down here that work in the doctor's office, because sometimes the doctor would much rather have a CNA than a medical assistant in his clinic. So you ain't doing nothing but pushing papers all day. You ain't doing nothing but taking BLS, figuring out, trying to make sure, you ain't doing nothing but taking weights and stuff like that. That's it. And then you're waiting on the doctor to come in. Sometimes they don't even have a nurse there because it's a CNA and a doctor. So there's no need for the nurse. They might have one LPN on the floor. Then when you go to the hospital, my last couple of days of having to go to the hospital, the most I saw CNAs do was when that light came on and them people was in that room, that light came on and CNA walk in there, what can I do for you, Miss Jones? Can I have a glass of, can I have some water? Can I have some juice? The CNA look at that chart, make sure they can have that juice, they bring that juice up in there. If there was a spill or a throw up or anything like that, environmental service came down. The CNA didn't have to clean it up at all. Environmental service came right on down and cleaned it up.
Okay, let me ask Purple this because I know she know real good. So what kind of, I don't know, the different positions, the RN, the LP and all that. What kind of hours do these type of jobs call for per week? What kind of jobs are you guys doing?
Well, the thing about it is what I was trying to get to that I couldn't get to. Like I said, STNA, CNAs, they have the dirtiest job. Yes, they do. They have to clean up at where I'm at anyway, the hospital that I'm at, or was at, should I say. They had to clean up, they had to take them to the bathroom, give them a shower, clean up their, change their diapers or whatever. But they can come in at 7, leave at 7:30. Whereas a nurse, we come in at 7. If somebody fall at 7:15, baby, we cannot leave. The STNA can leave. I can't leave. I got to do paperwork. I have to do assessments. I have people's lives on my hand. The doctor's orders. I had to actually argue with a doctor. I had to argue with a doctor because their orders to me as a nurse was unsafe. And it is my job to be able to do in the nursing process to determine whether that order is safe. Even though the doctor placed the order, I have to determine whether it is safe for the patient. I have people's lives in my head. Medications that I may see an order. I see.
I want to ask a question. Can a nurse override a doctor?
And yes, we can.
That's a question. That's a question.
Yes, we can. Yes, the nurse can. Yes, we can override a doctor. Wow. If I feel that an order is not medically safe, I can say no. If you want to bring your ass down here and give it, yes, you can. Or I can go to my supervisor or whoever and say, listen, I don't feel this order is safe. It may be a medication that I know a patient has kidney disease that I know is not, they can order 600 milligrams of gabapentin. That's just an example. We're not going to say this is just an example. They can order 600, but because this patient has kidney failure, only 300 milligrams are safe for them. And I can argue with that doctor. No, this order is not safe. From what I'm taught in pharmacology, from what I learned, this order is not safe for them. There are decisions that I have to make, not just for the patient. I have to deal with the families. I have to deal with the doctors. I still got to make sure my STNAs are doing their job, because if they take a blood pressure and don't tell me to read it, and this 200 over 100, now I got to come after your ass, because why didn't you tell me? Now I got to go recheck this blood pressure. It's so many things as the nurse that I have to cover from both ends.
Give me the hours. What's the hours that the job?
A nurse's hours.
Yeah, per week.
We all supposed to work 12 and a half hour shifts. We supposed to work 12 and a half hour shifts.
What's that?
But
So what y'all working 12 4s or
3 12s, 3 12 and a half.
3 12. Okay.
Because we automatically get docked for a 30-minute break automatically.
So do STNAs work the same type of hours?
STNAs can leave after they 12 and a half hours. They don't. There's nothing holding them. If my nurse don't show up, that's fine with me.
Depending on what unit you're working in down here.
You can give that to the supervisor. I've watched it happen. You can go to the supervisor and say, hey, such and such did not show up. It is not contractually, because they don't have a license. For a nurse, we have a license.
I mean, that's why I said depending on where they're at, because like when we were just in the trauma, that lady was trying to get out. That trauma came in at 6:57. She got off at 7. That lady had to stay there.
I mean, that's just because, like you say, they're Moors, but contractually, they don't have to stay. They don't have a license that's holding them there. My license hold me there until another nurse takes over. Because if I leave and nobody is there to take my NARC count, to take my keys, to give report for my patients, I can lose my license. Forget losing my job. I can lose my nursing license. I am contractually held there until somebody else takes my patients and takes responsibility. So until I give an appropriate handoff, I cannot leave.
What's the qualifications for the STNAs up there? Do they just do they have to do?
We take a state test. It's a CNA and an STNA are the same thing. Like I said, I walk every walk of life.
Are y'all able to challenge? Are the STNA? What do the S and the T stand for?
State tested. We are state tested. Where you are certified nursing assistants, it's certified, which means you went to take a test. We are state tested nursing assistants. That's what
What's the difference?
We went and took a test. We actually literally had to study and go to a class and learn about C. difficile, learn about how to even make a bed. We had to learn to make a bed with the comminuted corners. I don't know if y'all know comminuted corners, but we had to learn how to make a bed military style.
I call it the military corner. Yes, you got to do all that down here too.
In STNA book, it's called comminuted corners. And I'm going to tell you, that's how far back I go. That it's comminuted.
Now, hold on. Let me ask this.
They use the word. I put it as military because that was the only way I can remember. My granddad used to bounce that corn off that bed, and it better not go nowhere.
Yeah, we learned how to wash our hands in STNA school.
Now, let me ask Mr. Davis, because Mr. Davis has been in that field too a little bit. So, Mr. Davis, let me ask you this. Who's the most laziest out of all the positions I mentioned, which STNA, RA, and LP? Who's the most laziest job?
The person that ain't watching. The person that ain't watching.
Who's the most laziest that got these jobs?
The person, the one on the bottom of the top, like my lady. She say you can leave. It's all about the bread at the end of the day. They ain't making no bread to stay that long, bro. They trying to hide out. Listen, that ain't my job. That's somebody else. You're right, because like she say, at the end of the day, if you ever worked in the hospital, you realize the doctor only show up about 15, 20 minutes, and he go ahead and get that information to the nurse, and the nurse go ahead and run the whole show. Doctor got golf day on Wednesday. They got all kind of reasons why they ain't staying with her.
I can't stay here.
They got about 30 minutes in there, but I'm telling you, it's usually
the time they spend driving to the next hospital and shit. Like literally, they drive from 65 hospitals. I'm like.
Yeah, they do. They got to go to different hospitals.
Come in here, run in here, talk to these patients, literally be there
and go.
Like what? I can't even call doctor. She was just here. I'd be like, oh my goodness, you were just here. Samantha asked me something. Now I can't even find your ass because you gone.
So, Purple, who you say is the lazy? Got the lazy? Who's the laziest out of the position?
basically what he said, the motherfucker you can't find. I know some lazy nurses. I know some lazy aides. I know some lazy.
No, Purple. That's not the question. Who the lazy is? I ain't saying who you know.
No,
who would you say is the lazy?
No,
these people out here need to know.
It's the person you can't find, the one you can't see.
When they asked me on my first day as to who will make my job, make me a great nurse or make me feel great that day, if I had a great STNA, my STNA worked just as hard as I did. Some of my environmental service, staff worked just as hard.
Purple trying to jump around this, y'all. She don't want to tell y'all exactly who it is.
You didn't want to hear.
You don't want to hear. I mean, if you want to be for real, you know what? Let me dig deep down in here. It's the environmental service manager. That's the laziest.
Monique, who you got? Who the laziest, Monique?
The manager of environmental services.
Whoever y'all name, I'm trying to be in that position because I ain't trying to work too hard for them coins. So let me just go ahead and
girl, come over here where I'm getting at. I help you. You gonna come be an infusion?
You missed it. She don't want no help. She don't want no help. Shit, from the sounds of it, you work too motherfucking hard. She don't want no help from you.
Yeah, Purple.
When the beeper go off, that's when you find me. I ain't coming out till the beeper come off. I'm in the closet, sleep. Okay.
Hey, let me tell you what. She asked who the laziest. The motherfucker in there that know their rights.
Cause I'm gonna read my handbook before I go anywhere. My handbook said I ain't gotta do this. I'm not finna do this.
Oh my goodness.
Shit, that thing, look, they say I ain't gotta be there till 6:30 for shift report, nigga. I ain't gotta look, I ain't the one that gotta get the vital information, so I can be a little late.
Listen, I was in class the other week and we was doing posts, right? Now with posts, I can't, me and posts ain't too good. We good, but we all right. And the man was like, the question was, what do you do if you go to check the post and there's no post, you can't fill the post? Mm-hmm. Now my answer was, go get the nurse, because I ain't got nothing to do with nothing at that point. The baby dead. That's the nurse's job. At that
but you
point.
got two places to check it though.
Ain't you a nurse in school?
So listen.
Right, you can check it up here or you can check it right here.
So the nurse who, because he was in the same training class because he's trying to teach CNAs how to do their job. He's opening up a CNA school. So he like, what's this called? Damn, is it the brachial? One of them.
Carotid.
Yeah, the carotid, the brachial.
You got the jugular, your jugular.
So he was like, check right here. And once you check the fingers, check right here.
Check the jugular vein, carotid.
The nurse over the class was like, let me tell y'all something. If y'all go in there and touch a patient and they ain't got no post, walk your ass out that room and go get that nurse. Because, baby, at that point, your job stopped.
Done. Yeah,
that ain't got shit to do with you. And the longer you up there trying to feel for shit, the more you put the patient at risk. Time is wasted. So you need to go find somebody. She was like, baby, let me tell you something. You got the most basic job out of all the nurses, especially at the hospital. You don't do shit but bring water, check posts, bring juice, cookies, whatever they need. If they need a blanket, you do stuff like that. But at the hospital, you ain't doing nothing with no patient that involved their body other than checking vitals. That's it.
That's it?
Changing a diaper.
That's it.
That's all some STNA stuff right there, changing them diapers.
It's the same job. It's just a different title.
Yeah.
Oh, okay. Okay, I'm about to say that's all right.
If I got to revive a motherfucker or change a diaper, I'm going to just go ahead and put this diaper on you. I'm not finna be looking at God talking about why you ain't do this because the nurse told you, the doctor told you to do that. Baby, that ain't got nothing to do with me. I changed that diaper and I went out there and I got that nurse who took that oath. I didn't take none of that. I took a 120-hour class. That's all I had for you.
Now, I know we about to lose Purple because Purple got to go to work, and we don't want to keep her up too long because she'll be seeing double. She'll be seeing double tomorrow.
Listen, I'm seeing double right now. Shit, I'm sleeping.
Well, I'm gonna ask this question before you go. How do y'all feel about being in the field, the medical field, and you're a black person? Well, nobody black, but you're African American person. Well, you can't be two nations. You what you are in another nation.
You American with some dark skin tone.
You who you are right now, and the other nations call you out your name. You know how you, because they could be elderly or whatever. You know, I've had people tell me,
baby,
man,
I will give you an example of when I got called a
how do y'all
house
feel?
nigga.
But wait a minute, before you answer this, how do you feel? Did that deter you from from the job, or how do it make you feel?
It made me, you know what? I'm not gonna lie. It made me feel proud.
How did that make you feel
Because
proud?
because he was a black man.
Mhm.
And what I did, my intelligence, trying to help you, because I was in training at that time and I had to call my white preceptor in to ask her a question, which I was right. And I'm like, so I was right, you know, we got to take these other pills. So I took his pills. Oh, you old Uncle Tom ass bitch. He called me Uncle Tom ass bitch. I said, sir, I said, because I'm trying to save your life. Because I don't want you to overdose. I have the same cup of pills that are sitting there with a few extra that you need for your dialysis. Like, but then, listen, I was trying to be nice, and I'm not. Listen, I'm gonna let y'all in on the secret because I was trying to be nice. I was being nice.
Oh, damn.
I was real calm with the man. Like, you know, don't call me too much. But then he kept calling me little ugly bitches and all type of
Oh
shit.
my God.
I was
Oh my
listen here, sir. I said, well, the next time you decide to call me uneducated, what do you say? Next time you call me Uncle Tom, make sure you call me an educated Uncle Tom, motherfucker. I said, the next time you want to talk about me, I said, make sure you can walk on them 2 raggedy ass amputated legs you got over there, bitch.
Oh,
said,
no.
Because
That's the patient.
He unbecame the patient when he kept calling me bitches and threatened to have his biker games come and get me, and then he was threatening my nurses. And no. Just make
Don't
sure
you supposed to say and
I'm not used to say.
Hey, get some shit started. You about to get some shit started. Go ask that dumb ass question you finna ask.
This
Go
one
ask.
and told them to do a mental health evaluation. Y'all hook him up this damn machine, see what's wrong with this man brain. Put him through these tests.
But don't you supposed to stay professional at all times?
Between me and him, I was real professional.
By calling him something back?
Between me and him, I was real professional, and I said it in the most professionalist way.
Mr. Davis, you ever been called out your name?
Hell yeah, I taught special ed. I just told you, man, I worked in the mental health hospital, man, every day.
And you can't let them people keep abusing and talking to you like that.
Oh, well, it's ways to do it. I ain't gonna get online and say, you know, I told somebody's motherfucking head off that they was talking crazy to me.
I didn't put my hands on him, but I made him feel this little because his raggedy ass couldn't get up and walk. Like, why?
Well, I'm gonna ask my last question because I know Purple got to go.
You should have killed him with kindness, Purple.
I did. The kindness of his intelligence is this fucking big. Idiot.
Oh, wow. He's not in his right mind, Purple. So you didn't have a right to do him like that.
Because when I'm in pain, I'm going to say some shit to you and apologize once I
He was not in pain. He had been rude like that to some of our oldest, nicest nurses. Listen, I was just the nurse that was going to put him in his place that day. He had already did this to 6 of our other nurses. And what pissed me off is when I learned that the supervisors and them wasn't doing nothing because they wanted to keep $1 coming in there. Or you can keep them dollars coming there, but I'm about to dog walk this man behind these closed doors.
He was a patient, girl.
Okay. He was a patient, and he got treated like a patient. I gave him his medication. I made sure he wasn't overdosed like he would have liked me to let to happen. I made sure he was very well taken care of, but I'm also going to teach him a little bit about respect and who you talk to, because you got the wrong one.
You know, my sister, she was in the, I remember when she was a STNA back in the day. I ain't going to mention the place here. And I remember she came home one day. She said, I'm quitting this job. I said, why are you quitting? You making good money. And it's actually around here. And she said, because it was a white lady she was taking care of. And the white lady told her, we should have kept y'all. We should have kept y'all in chains years. You know, we should have never let y'all in chains. My sister came home, broke up from that. I said, girl, you can't let that stop
Oh, no, you can't let that. My mama used to come home every day.
She was at a nursing home.
I done told her, bitch, this is your change. See that? You are in change right now.
You can't do that, Katie.
You are in change. Look at you change right now, Betty Sue.
This lady 80, 90 years old. She 80, 90 years old, Purple.
Okay. My mama used to work as a CNA.
Mr. Davis, lift your head up.
Cause y'all got a problem, man.
They got a problem.
You off the chain.
Yeah, you are in change. These are your changes.
Hey, and don't get me wrong. Some of those ways is the way you handle that shit. Cause look, this is me. You the one sick. I'll take care of your ass. So you talking crazy, but
trying to take care of you for, and you being an asshole. What I do to you?
Now, what I will tell you, Miss Purple.
Uh-oh.
I don't know how you are as a nurse, but y'all gotta communicate to y'all nurse peers to start shutting the fuck up and listening to the patient. Because if a patient tells you something is wrong with them, don't try to reword what they telling you. Understand what they saying to y'all.
Uh-oh. Oh, we got the STNA challenge in the nurse.
No, this is from.
Wait a minute, hold on. Do the STNA can STNA override the nurse?
Hell no.
STNA can't override the nurse.
You heard her say she ain't got no license, nigga. No.
No, I can only do stuff to get you in trouble because you're not listening to the patient. I can report you not listening to the patient if I'm in there.
Go let her know how that work, Big Ari, and tell her once you get reported how that's gonna work.
What I'm saying is from a patient standpoint, not from trying to work in this field, from a patient, because I'm currently a patient.
Okay. Well, I listen to all my patients that have respect.
I don't know how you will. That's why
I listen to every last one. I advocate. I am the biggest advocate for my patients. My patients
I ain't say you. I say you got to reiterate it to your peoples, because it's a lot of nurses that
I'm trying to get them peoples out of there. So we ain't even gonna talk about them people.
Right. I went to school and I'm educated and I know what I'm doing.
Mm-hmm.
I need people to understand
you know more than what your body know. No, I know.
People don't understand that everybody got a different way of describing something.
I know. I just heard the STNA say tell the nurse they need to learn to shut the fuck up.
If I tell you I'm in pain and I feel knots on my body from here, and here, at some point you should know. I don't know the terminology, but if I'm telling you I got knots in my body, bitch, don't tell me I need to drink water.
First of all, how you finish the STNA class and don't know the proper terminology of this shit? That's my problem right there.
Again, Mr. Davis, I said I just started this. Again, I just started
this. You said we was on our way to go to the LPN type shit right now.
Yeah, it's Mr. Purple.
So that means you got to be finished with the STNA, bro. You should know some technical terminology in this place.
I'm starting to get sleepy with my sleepy time. This is going to be the last thing I say.
Yeah, go ahead.
But on to what you were saying. And as a nurse and also as a patient, because what you fail to realize is that a lot of nurses do shit like that. Doctors do it too. You have to learn to advocate for yourself, because sometimes not all your nurses are going to do it for you. Yes, it is their job, and they do need to learn and listen better. I am the nurse that will advocate for any one of my patients. I associate myself with nurses who will do the same. But depending on what type of hospital you are in, what type of nurses you are dealing with, they think they know more than you do. And sometimes you need to make them understand that they don't know your body like you do. I literally had to tell a nurse, as a nurse, that man, you don't know my body like I do. When I knew, so matter of fact, when I had COVID, remember I told you I had COVID and I knew I had COVID. I was the only one that knew something was wrong with me. And no, it wasn't because of a cough. It wasn't because of a fever. It was because I felt weird. She's like, you're going to go get a bitch? Yes. And I'll go do your test and your test. And all three of them tests came like positive. She's like, well, how did you know? Because I know my body. So you need to start listening to what I'm trying to say. And if that person doesn't listen, then go to the one up above her. They have a nursing supervisor. Because every nurse did not learn to critically listen, because that is important when it comes to caring for people. It's sad and it's fucked up that they missed parts of nursing school, and I don't know what part they missed. Well, there's nobody ever going to be perfect in the healthcare field. Nobody. I've not seen it yet. Where I'm going, I know I'm not going to see it, but we're working on it. We are improving as best we can. But what you can do is advocate for yourself, speak up for yourself, educate yourself on what you feel like you need them to know.
Last time I advocated, Miss Purple, they put me out the hospital. I had to go to the hospital.
Oh, and that's fine. Listen, I had fucking right down the street here. put me out. I had an appendicitis. Appendicitis was ruptured. Literally was ruptured, baby. They sent me home, sent me to another doctor. That doctor had nerve to call me a drunk. Told me I was a drunk and I need to do this. Now, listen, I went back to that same hospital because, bitch, you going to do this test again. I'm a registered nurse at this time because you need to listen to what I'm telling you. Something is wrong. They did this CAT scan again because I'm about to put my foot in y'all ass. Like, we either gonna fight and I can halfway lift my foot up. I could barely walk. Come to find out, they ran that same CAT scan 26 hours later. Same CAT scan. My appendix had ruptured. So now y'all got to go do a more extensive surgery. They rushed me up to surgery. Because you weren't listening to me when I came in here the first time. You sent me to this doctor who brushed me off as well and said I was a fucking drunk. Then I came back in, they looking at me like, well, what you want me to do? I want you to run that same CAT scan. Something is fucking wrong with my stomach.
Because once the doctor could, I don't know if it be the nurses writing down the symptoms to go back to tell the doctor, or the doctor just only hear a piece of what he said.
No, it's not even here, baby. They see your beautiful black skin. They see how you're young in age, and they have already made a assumption as to what's wrong with you. You want pain meds. You want drugs. You a drug addict. You drug
you want
ass. They look at our beautiful black skin and our black age and make us drug seekers. I've watched it working in the rehab hospital where I've had to cuss out the doctors because Miss Sue, white lady, 72, ain't shit wrong with her, can get the Vicodins and the oxyeds and all of that shit that she can get, whereas Miss Crystal over here, 50 years old, just had both her legs amputated and they want to give her fucking Tylenol. No, bitch. And I literally had to sit there and go argue with the doctor as to why she getting Tylenol.
We got a gangster nurse on here, y'all. Hey, check this out before you go, Purple. I know you got to go, so before you sign off, I got my last question. So is this a good job for somebody who's young, fresh out of school to come into, as far as these fields we named the RNL?
We need young, fresh-minded, fresh-willed nurses to come in. But at the same time, a lot of these nurses, the young nurses coming in thinking that it's a money grab. And healthcare is more than just a money grab. It is still morals involved. So we need nurses that have a moral about them to actually care for people to come into. Yes, we still need.
So you need people with more the ability to care for the patients,
the intelligence to care for it, and say yes and no, this is right and this is wrong. That's what we need, not them little dollar hungries like, oh girl, I'll be able to see how much money I make. I'll be able to get my hair and my nails done and travel. And this, that, and third. No, that's not what we need. We need real ass nurses.
Yeah, because think out there, y'all. Everybody gonna get old. They gonna need somebody to take care of them. So you little money grabbers that Purple talking about, y'all get out the way and let
get out the way
real people who care, like Monique.
I'm trying
Monique
to
help people really care about.
It's not that I care. It's because I want to, like Miss Purple said, I want to be able to advocate for myself. I need to know the terminology.
Or that,
you motherfuckers, what's wrong with me?
Be able to advocate
I've been going to y'all hospital for the last 2 years. And this is just a brief story, Miss Purple. Then we're gonna let you go. I had to go see a gynecologist because I've been dealing with medical issues. Mr. Davis, you came on late, so you didn't know the medical issues that I was dealing with in the previous year. Mr. Davis, just a year ago, I was 60 pounds lighter. Out of nowhere, I started gaining weight, like literally out of nowhere. Weight just started piling on. My diet didn't change. My exercise didn't change. Something was wrong with my body. So I go see my primary. He sends me to like 6 different specialists. One of them was a gynecologist. He said, go see the gyno because she can tell you what's wrong with this part of the body. Before seeing her, I had to go through a series of tests for her before I could see her. I get to her office. This bitch had not even looked at my test results before she told me what was wrong.
What was it, your thyroid?
It was none of that. I have tumors, and they're growing over a certain part, like over organs and things. I know this because I can feel them, because I'm telling you, I have knots in me out of nowhere. They're growing out of nowhere. I can feel them. This lady tells me I have PCOS. Then she says, I'm going to run this test and this test and this test. ma'am, I've already done all those tests. I did those tests before you came in. Oh, you did? Let me go see. Oh, well, based on what I see here, you don't have PCOS. Bitch, how you gonna give me a goddamn diagnosis and you never looked at the paperwork? Then my doctor said, my primary said, well, I'll just refer you to, I'll give you a second opinion. How you gonna send me to somebody in y'all same branch that's gonna give me a second opinion? She ain't gonna do nothing but look at the paperwork that the previous doctor looked at and say the exact same thing. She's gonna go off what the last doctor said. And I'll be damned if that's what the last doctor said. I had to go through 5 different doctors before we finally realized that I had tumors growing inside of me.
So did they get them all?
No.
Unfortunately, that's not health. That's a health disparity among Black women, Black individuals, especially Black women. We are discredited and not looked at respectfully enough. When I was pregnant with my daughter, a white nurse had to argue with the doctor and basically send me to the hospital, because had I went home, I probably would not have made it. Me or my daughter will be dead, because the doctor was just, it was just the overlooking, the lack of care, the lack thereof of care. So sometimes, unfortunately, because of the type of healthcare system we live in as Americans, as African American women, that we have to go find doctors that look like us. You understand? We have to go talk to doctors that look like us.
Not many of us in the field, though.
But it's starting to become more. If they just stay their butts off TikTok, they'd be good.
I mean, it's some good doctors. I don't know what kind of tumors you have, but this is you not here, unfortunately, because it's like this doctor named Dr. Goji. Like, I was suffering with something so bad. And it was crazy. My Indian doctor, no, she don't look like us, but she's brown like us. She's a brown person like us. She referred me to this doctor, and she was a Black African doctor, and she was able to help me with something that these white doctors couldn't have touched with a 10-foot pole. Years and years and years. This kept giving me all the same stupid ass medicines that they have lined up. But this Indian doctor sent me to this Black doctor, and she handled it like that.
I wonder why. She was able to handle it. Because
I don't know.
She understands melanin.
Out of all the doctors that I looked at, a gay white man advocated for me. It was a gay white man.
Why he just can't be a white man? He got to be gay.
The gayness played a part. I'm trying to tell you, the gayness
white
played a part. Because I've seen white men prior to that. I was just brushed off. I was a nigga to them. But to the gay white man, at first he didn't take me seriously because I was laughing while describing my pain. I laughed to get through my pain because I have a hard time crying. So I'm like, I'm really in pain. And I'm like, you can see. So he comes over. As soon as he touches me, the tears come out because I'm in that much pain. And he's like, I've never seen this before. You're really in pain. Yeah, I'm really in pain. And I've been saying this for a year that I'm really in pain. But it took him advocating, and he would not stop until we got some type of diagnosis. Now, the problem is, I had to, moving down here, I'm not going to say the healthcare system is better, but down here there are more Black people in the healthcare field. And my Black nurse that I went who I went to school under, she advocated for my health now. She goes with me to my appointment. She sets me up with all the doctors she's worked with. I have to be up under people that are going to hear me out, because the way I express pain is different. When you're at a 10 and you're in pain, they expect for you to be crying, your heart rate elevated, all of those things. That's what they determine as a 10. I'm in a 10, but I've learned how to control my emotions with the pain, because crying ain't gonna do nothing. It ain't gonna do nothing. Make it hurt worse.
Okay.
I heard Monique say that the doctors up here ain't shit opposed to the doctors down south, and I think that's some bullshit. Because I went to school in Mississippi.
No, stop. That's not what I said. Because if you remember correctly, Mr. Davis, I just moved from North Carolina to Florida. So
Okay.
that's what I'm referring to.
Oh no,
Doc-
but when you said y'all got doctors up there in Cleveland and they ain't A, B, and C. Cleveland Clinic one. Hey, all I know is
I
this.
don't know about Cleveland. I said where I just came from.
Every time I go down south, dog, they don't get the shit right. That's all I can tell you.
I don't know what south you went to, but down here, where I'm at, and you know,
Oh my
they
God.
got it right.
Well, let me say this before we go get on over here. Hey, listen to Purple, listen to Monique, listen to Mr. Davis. They've been in the medical field. I can't give you nothing but some Tylenol. But I would say, listen to them. They advocate to tell you, get you a doctor that's familiar with you. You know, somebody who can get you.
But another
right
thing,
medical.
real talk.
Hold
You
on,
have
hold on.
the internet.
Hold on,
We
Mr.
can
Davis.
look
Hold
up
on.
our symptoms.
Hold on, Mr. Davis. Let me finish what I'm saying. Then you go on. And, get around a doctor that can help you understand your symptoms and what you try to get to, and then you should be okay. But go ahead, Mr. Davis, before we sign
No,
off.
but just like she said, when you start having certain pains, then you educate yourself. You start looking up things. You start talking to different people. You start, because just like they say, some doctors may not know.
Yeah.
And at
Well,
the end of the day,
actually, doctor told me before, you're really the doctor because you know where the pain is actually at. You tell them, hey, it's back here or it's over here. And then they do they MR or whatever y'all say they do. Go ahead.
this was very insightful. I'm talking about very insightful.
Yeah, y'all see, that's why I say I got to bring on the people that know about this stuff. And
nurses, if somebody tell y'all where they veins at, that you can get the best blood out of, listen to these
That's
people.
where you go. That's where
you go.
That's where we try.
So if I tell you
Where
only
you
draw
go?
blood out this hand, don't go down here.
Yeah.
Draw blood out this hand.
I'm gonna try now. When I miss out that hand, I'm gonna tell your ass. Now I'm going back where I first saw.
You ain't gonna miss.
No, baby. I had a patient. Listen, I do IV infusions. I had a patient who tried to tell me because she has scar tissue. You do know what that is. It builds up after somebody keep poking in the same area. But I gave her what she wanted. I seen the scar tissue.
Shit, that butterfly in the hand shit hurt like a motherfucker. I'd rather get it out the arm.
I mean, some people actually got good veins, but I will give the patient the benefit of the doubt. If you say go here and this is where you want me to go, I'm going to give you, because I'm the same way. Don't poke me where I tell you don't poke me at. Now, if you don't get it and you need to go somewhere else, now, okay, you figure it out.
But me, I ain't got no good veins. I have
Okay,
terrible
Dr.
veins. These float, they move, and they very small. Only a butterfly needle is going to get up in here. And it's not going to get up in here. You're going to have to go here or here.
But could I ask a question? Because, you know, people that's STNAs and RNs and all that, they always tell me, how do you know when somebody got a good vein to actually even tap into? Is there a certain way or?
Bouncy. It's bouncier. It's more visible.
It's that big motherfucker that's sticking up out y'all.
But that don't mean it's a good vein, Mr.
But it usually does though. You know, the one, like she said, the one that you can see, the one that just look like it's got blood in it, brother.
what I'm saying is, people say all the time, like Purple just said, people miss them. They be poking.
But but one more time, if you miss the vein, that ain't the vein's fault. You shot through it. So that's the problem when you taking the blood. That's the problem. You got to be. If you shoot through the vein, you ain't gonna get a damn thing.
Leon, what you say? What's the best way to get the blood out the vein? You a doctor too. Come on, give us.
I'm actually, in school, so I haven't actually physically did it yet.
We got two school people over here, Mr. Davis.
Yeah, but they missed that.
I think
But
Miss
the doctor
Purple
was
is the
purple,
best
so
one.
shit, they should have got the lesson with Purple.
Yeah, Miss Purple is the more knowledgeable. She actually physically done it. I've only done it on a dummy arm. So
It's a feel. It's literally a bounce feel.
you can. I know that they taught us you can see, like she said, the bounce. You want to be hydrated. You want to make sure that it's because it's not. Sometimes it ain't the one, Mr. Davis, that you just see and it look like you got blood in it. Sometimes.
Understandable, but when I worked at St. Luke's, I was a mental health tech. I did the phlebotomy class. They gave us a crash course in the shit. I'm talking about it's the same thing, but one more time, 9 times out of 10, a lot of people shoot through the vein. A lot of people don't do
What you mean when you say shoot through the vein? You mean blow it?
That means you done stuck the needle past the vein. You can stick it in there, and if you go too far, you just shot past the vein.
Yeah, that's not good. Okay.
So I've done a lot. I've done a lot of them. Some of they give you a crash course in that shit when they don't want to really pay no goddamn body.
Damn. Ain't that right? At least you experience and you know. So when you go get your blood work done, you know when they don't know what they doing or whatever.
Right.
You know what I'm saying?
I give them the same vein. Go, this motherfucker been working for years. Go get.
Yeah, get this one.
Cause like I told Purple, that shit in the hand hurt like a motherfucker, brother.
That's
that
not the
butterfly
ideal
shit.
place. Like, why would they start in the hand either? You know, that's not.
Because some people are good. Some nurses are good with it.
No, some nurses get it right out of that hand, right?
Yeah.
Like for ketamine, we got to start in the hand.
From what I've been told, they don't
For
want you to
ketamine?
start out in the
For
hand.
ketamine, we have to start in the hand because they get it 5 doses in 5 days. So
Who are you giving ketamine to? People with depression?
chronic pain and depression, yes.
Oh wow.
You guys are good.
Give them some of that Haldol, nigga.
Oh my God.
I
I didn't know that they give ketamine for chronic pain. I didn't know that.
Yes, fibromyalgia patients.
That makes sense though.
That doggone Purple is good, boy. She
No,
knows
she's
this.
No, I
very
actually
good.
have a vein, like a
vein finder.
Yeah.
They got a vein finder?
Oh yeah.
Let me see what you mean. Let's see that again, Purple.
It doesn't show really well on the screen to what you will see compared
That's
to
like a
If you hold that light on, do it light up, do it what?
you just see the vein like
You can't really tell. It look like on the
Okay.
Yeah,
Monique, you
because
gotta
That's
get one
all
of
right.
those,
light
Monique.
from the screen.
How long them been out?
You gotta get one
You
of
know
those.
what?
Y'all, you
Oh,
and Lynn
they
gotta get one
got
of those.
them. Like we have them in our office.
Monique gonna stop. Monique just gonna stop at Med Tech where I can pass them people medicine out at the nursing home. I ain't doing. No.
Monique, you gotta
have
go
to get all
further
that
than
together
that.
before you start coming on the screen. What I
You
tell you
gotta go
about
further than that, girl.
every time you on the screen, hey, get that together. We'll work that out.
Hey, Lynn, let me ask Lynn before we get off here. Lynn, who the laziest at these jobs? Like as far as between the RN, ST, and the
You got both.
Which you can't have both, man. Give us one.
You can
Somebody
though.
that lazy
Unfortunately,
is.
you can.
Somebody
You can.
that lazy is.
Unfortunately, you can be a lazy RN. You can be a lazy LPN. That's on you. But you definitely got the lazy STNAs, the ones that just come to work with an attitude, acting like these people don't really need your help. And
So
they
nurses
make it
not
all about
lazy.
them.
So nurses ain't lazy.
Oh no.
Yes,
some
they
lazy
are.
nurses.
Yes, they
You
are.
know he like to
It's a
start that bullshit,
I'm
no?
just asking a question, brother.
But the nurse gave you that answer. She said all of them. This lady come on and say the same damn thing. You talking
No,
about?
she
You got
didn't
to
say
pick
the
one.
same thing. No, she didn't say the same thing. She
She
said
did.
it
She
can be
said
more
all
than
of
one.
them.
You got some, but you know what? It's more serious. I mean, if you're a lazy
Yeah.
RN or a lazy LPN, because you really,
That's right.
you're not being an aide, just cleaning somebody up and doing. You have more serious, serious skill set, and you
Okay.
have people's lives in your hand. So
Right.
you got people that don't pay attention and do it the right way. Hopefully they don't do shortcuts, but I'm pretty sure it's people out there. I think probably I was about to call her by her real name. Purple but probably heard of that dang on story. The people at clinicals, you got instructors. It's different. So it's so many different specialties and different avenues, and you got lazy ones everywhere you go. Just like you got a lazy mechanic, maybe a lazy barber. It's different occupations.
Yeah,
It's
I
just
know a
the type of
lazy
person.
barber, babe. Yeah, you're absolutely right. I know
Yeah,
one
she
of
would
them.
have to throw that.
But I mean, I don't understand why people do get in that field if they have that mindset. But it's
Mr.
all
Davis,
that's
somebody said you snitching on St. Luke's. That's why it's closed because
St. Luke's been closed for 30 years. They ain't snitching out that shit. St. Luke's been closed for half of me been bored. Shit.
You ain't laughing today. I don't know who said that, but God, no. They say you snitching on St. Hey, hey, tell Lynn before you get out here, and I know Purple gonna leave us soon. So what kind of hours do you expect to work in this field? How many hours a week do you think you expect
I
to work
mean,
a
for
week?
me, just 36, 312s.
Oh, you ain't gonna work no 60 hours.
Hey,
50
hey,
hours.
but Lynn, tell them times when they go crack their head and you can't go home.
You think you about to get off until relief don't show up and you got to stay.
Monique, you sure you want to go in this film?
You notice how they said nurses, right? They didn't say nothing about STNAs had to stay. Purple already told y'all STNAs get to go
y'all don't
home.
gotta stay.
They should though. I'm
They
right
sh-
now.
they
I had
should.
to leave
No,
a
the
job
more
to
she
go back
learn,
to.
the more it
Lynn,
just
where
sound
I
like
know
to
you
me.
from? Because now I'm like, I think I'm
Huh?
high. I said, I think I'm high, but I know you from somewhere.
Oh, I'm Mo's friend. You was in the shop the one day.
Oh, I'm like, I think.
You funny as hell. Talking something I think I'm high, but come on, RN.
Right, yeah,
No, I was
yeah.
telling you, we was discussing about, your journey, and your also journey with your occupation and injury and how that goes too, and how you
Yeah.
how you graduated top of your class and how I was struggling with some classes and things of that nature. So, you,
Jerks.
it's so crazy because this, I can cuss, right? But this shit will have you going through the process. Roxanne, excuse me, Purple can probably speak on it, but this shit will have you just rethinking. You gotta want it really for real. It's
Really
not no
bad.
game. It's
Really, really
not
bad.
fun. It's not for the weak
So
of
how
heart, weak of
how
minded.
stressful is it, Lynn? How stressful is this stuff?
I forgot. It's so stressful that you told me earlier that we was gonna do it, and I forgot that quick. Of everything, it don't matter because what matters to me is I need to be studying.
She said it's so stressful,
Yeah,
and
I
that's what
forget
you should, and
everything. Your
that's what you
brain is
should be
clouded. Your
doing, ma'am.
mental.
But no,
Yes,
I
and you
listen. It's
have
so
no
stressful.
time
I
for
know I gotta
nothing.
get up and go to work at 5:30, and I'm about to go to bed because it's past my bedtime, y'all. I love y'all.
Mhm.
It was
Well,
good.
thanks for
Look,
coming on.
with my
Rock Purple.
tourniquet, with my tourniquet.
Uh-oh, she ready to find a vein. Mr. Davis, get
Mr.
Mr.
Davis, you know
out.
that tourniquet.
Miss Davis don't want to lose no blood, brother. Hey,
Good
don't see. There
night.
you go. There you go. Take
Good
the blood.
night.
Hey, you heard him. So you can get the blood from somewhere else, brother.
Good night, y'all.
Hey, you
Good
can
night.
get him. Hey, Purple, you get about a pint and a half, 2-3 pints out of him.
Damn.
He
Yeah,
lying.
he got plenty of blood.
I
to
do
give.
apologize for coming on late. Yeah, it
You
definitely
good? It was
your
good.
brain be wrecked. You don't
You
remember a lot of
good.
stuff,
You
you know.
good. All right.
Where's
Well,
Mo
thanks for
at?
coming.
So what
Jen,
was
come
the
on tonight.
beginning topic? I'm sorry, Mr. Brainbuster.
Oh, that's okay. It was about healthcare workers tonight and how stressful y'all jobs are in that field. How bad.
We
Now,
tried.
I'm
Hey,
on the
we
road
tried
now.
our best to have a conversation tonight. That was a little
yes,
mellow. That was educational and
yeah,
informative.
I was a viewer last week on
Yeah.
wee. Bless your heart. But anyway, but I struggle with in the healthcare field. Like I was trying to say before Purple left was I left another job because I'm almost done with my RN. And I needed to get back.
Okay,
I was an
that's
aide
fine.
before when I was younger for many, many years. And it's very, very taxing on your brain still and your body. You got to deal with so many different type of personalities, deal with the dang on healthcare professionals that are also nasty sometimes.
Right.
You just want to be treated like you matter, just like the patients do.
I got a question.
So, mm-hmm.
Once you finish, now, like you said, it's going through school, going through the process and A, B, and C. Once you're done, is it easier or is it harder to be a nurse than it is to become one?
I can't speak on that because I'm not there yet, but what I've been told and advised is that it's harder.
Okay.
Because what I've been advised by many nurses, particularly Black women, and I've had some white nurses tell me, nursing school gives you the education. Actually being the nurse and getting on that floor and doing the work gives you the skill set. But the thing is like you're a baby goldfish in an ocean of sharks. You have a lot of, unfortunately, I'm kind of nervous to enter it, but I'm gonna do it.
You
They
don't. You
stated
shouldn't.
that.
You shouldn't.
What you gonna tell
No.
the
I'm
nurses?
talking about this aspect.
Oh, I
This
thought you
aspect
said you
that
was
I'm
finna say
speaking on
something you
is
ain't had.
just no. The aspect that I'm speaking on is basically they basically say that you basically just thrown out there with no life jacket, and other
Okay.
nurses don't really want to help you. It's kind of like they want to see you fail. Unfortunately,
What?
they want to see if you can swim. They
But
don't
They
give
don't
you
want
the
to work
nowadays, but
together.
resources.
that's most jobs, dog.
Yeah, but
That's not just in the
it's
nursing
just like
field
why would you want to be like that? We trying to learn from each other. We
because
got to take care of these
y'all
people.
competition. And at the end of the day, the newer people come in, the fresher people come in, then y'all take their jobs. So when you look at it and you look at
They did say it's most of the older nurses that's like that.
that's right, when the salary is there and the money is there, because the longer you've been there, you pay them a little bit more. And then when new people come in,
Yeah.
they try to get new people your time to cut the money plus get a new people to experience. Them old people want that money. It's the money. It's
Mr. Davis, that's called job security.
It ain't when you don't teach nobody else. Sit down.
But you gotta have a heart to do it, a mindset, like a nurturing nature. You know, you can't just. It's a lot of people that I don't understand. These classes are not easy, but they go through it and they don't have the right attitude.
Now, Leah, let me ask you this. So you and Monique can answer this. So are you telling me you shouldn't be so caring in this field? Because I heard some STNAs and all, they say, man, I care about the patients too much. And a lot of people that work, and I ain't gonna name different levels, like Mr. Davis said, RN, they don't really care about the patients.
And that's not good, because I mean, just picture this. Not even talking about you being in the hospital. If you sick, right? Mm-hmm. And maybe let's just a hypothetical scenario. You sick, say you're a teenager, you're a young man, your mama coming there, you ain't really got no medicine, but just having your mama there holding you, you know, giving you a warm blanket, that therapeutic love helps. So it matters how your attitude is, because that also helps people get through stuff. If you come in there all nasty and all rough, somebody dying of cancer, that don't make them, you know, sometimes you never know that.
Go get your charge nurse right now.
Oh yeah, but like that helps a lot with your attitude. And when you don't care, I don't want to say you shouldn't care, because I feel like, you know, I have not that experience on the floor yet to say that.
Well, they've told me that they care more than the next STNA or the RN.
They might, because I know I do.
And they kind of get in the way, because a lot of them, like Roxanne just said, I mean, Purple just said, you know, just some people just there for a check.
Yeah, and I'm not one of those people.
Give me the nurse that overly cares.
That's me. That's gonna be me, because I'm the aide like that too.
But watch this. But more importantly, though, here go the flip side to that coin. Those be the nurses get burnt out like a motherfucker too.
Yeah, see, that's what I'm saying.
So you got to know your limit. You got to know your limit.
But here we go.
And take care of yourself.
Everybody has a limit, but when you working in a hospital and they're so demanding because they're shorthanded A, B, and C.
Well, I ain't talking about that part.
Yeah, but all of that goes into that's
I'm
me.
just talking about making sure I give my patients their proper care.
But this is what I'm saying. But then you giving your patients the proper care, but then you run into one like Purple said, that cusses you out, don't have no respect for you, A, B, and C.
That ain't my problem.
Yeah, but you run into, I'm talking about more people run into those type of people, depending upon where you are or what area that hospital is located in.
But do you think that, wouldn't you say also, I mean, it can get draining, but would you say it's also that the nurses or the aides mindset to not take it?
One more time.
My mindset is like.
But when you talk about a mindset, you don't know nobody that's gonna go to work every day.
Well, I'll tell you what, Mr. Davis, it don't matter what job you do, you're gonna get burnt out,
and that's my point. That's my point.
Yeah. But I feel like I'd rather be burnt out with a purpose than just be burnt out from doing mail, sorting mail.
For a living. Right, I am supposed for a living.
Depends on who paying me the most.
And I was burnt out by listening to you cuss me out every time I tried to help you pay your bill and get your services and sell you a product.
Oh, I thought you were talking about Mr. Davis.
I was look at my face. I'm like, what I do that?
I was like, you pay his bills?
It don't matter what field you're in.
Hey, first of all, man, your own business now.
But being passionate about something will help you get through it a lot better. Because when I was passionate about being in the sales field, I didn't care about you cussing me out. I liked what I did. Mm-hmm. In this new position, I don't like what I do.
I do believe by far, I do believe the medical field. I do believe the medical field is one of the most stressful out here. I will say, if it ain't number one, I'll put it almost number two. Mm-hmm. Man, the stuff I be hearing from people.
What about school teachers?
That's what I said. I don't think it's over.
I can never be no school teacher, baby.
Yeah, that's been a test.
You know, during the COVID time, 2020, and the kids had to stay home, like homeschool. I was damn, get y'all ass out of here.
Yeah. Now you see what teachers go through. Y'all
respect
them teachers.
And then they don't pay them good.
It's worse when you say that about your own damn kids. Listen, them ain't the teachers' kids. So you know when they come to school, just like they got
20 more of them. They got 20 more of them. I can't do it.
But they going hard in the paint. If they drive you crazy at home, multiply that shit times 5 when they get to school.
I definitely get it, and that's why I put my hat off to them always. And on top of that, they don't even get paid like they should for dealing with that.
Not no more.
That is the most saddest thing. One of my teacher friends, she's now assistant principal at a school, bless her heart. But I also didn't realize, like when I used to be in elementary school and your classroom all nicely decorated and all that come out their pocket.
It does now. Like I say, it didn't when we first started. Teaching profession was admirable. Now they hiring anybody that can go down there and pass the test. They Uber drivers. They don't care what you did, because now it's all about it's all about having bodies to babysit.
A lot of people also go back to get like their doctorate, because I guess you get paid more, of course, to be a professor.
Yeah, but one more
college.
time, ain't none of that shit worth it no more. Because it don't matter. Why would you pay me $100,000 because I've been teaching for 30 years, opposed to paying somebody else 20 to 30,000? Because here go the thing: that real deal is this: the kids ain't learning.
Mm-hmm. And they'll be having behavior issues because whatever going on at home.
So at the end of the day, you paying babysitters.
So, Mr. Davis, let me ask you this then. What would you say to the people that's watching right now that want to go in? Hold up, I'm finished to ask you. What would you say to the people that's watching right now that want to go in that field to be a teacher? What would you recommend for them right now? Would you tell them to go into it or not go into it?
Not. It's gonna burn y'all too fast, and the money don't pay you for the headaches and the bullshit you got to deal. Don't, just like they say with a nurse, going to school don't teach you how to deal with parents. Going to school don't teach you how to deal with kids that's off the chain. Going to school don't teach you how to deal with teachers that think they know more than you. Going to school, being a teacher, just understand this: they have to be responsible for a patient when they're on a shift. You have to be responsible for somebody's livelihood. You understand what I'm saying? And the biggest problem with education nowadays is you don't have no parental involvement, bro.
Yeah.
If by the time a kid get to kindergarten, they don't know their name, they don't know their phone number, they don't know their colors, they don't know their letters, none of that. Right. So by the time they get to you got to spend them 2-3 years teaching that shit, which now they probably
hope they don't
grade,
repeat the grade. Look, I hope they don't repeat the grade and return to your classroom.
But here go the thing. This is what's so fucked up. People, you can't hold them back. All your parents got to do is
the right stuff. Like, why they can't add other
But here we
stuff?
go. All of them ain't gonna learn the right stuff because they didn't come in knowing the basics. When we was little, before we went to school, we knew
They
our
took cursive away.
They took cursive away for a reason. We'll talk about that on another time.
I would love to know why, because I'm like, why they can't
Because
make my
watch this.
signature?
The only thing that they have in cursive now is the Constitution, right?
Oh wow.
So at the end of the day, in about 20 years, you got to understand, if they can't write cursive, they damn sure ain't gonna know how to read it.
That's right.
Right? So in about 25, 30 years, when they start changing laws and shit, when they change law, they gonna tell you what that shit means instead of you being able to read it for your damn self. You see what I'm saying? A lot of things, that's how they erase history. When they take cursive right now,
that's a passive way to be horrible. Just be patient.
So what's a good, before we get off here? So what's a good field to go into before we go?
I heard that cyber tech, like the cyber and all that type of stuff, is good because it's the
Mental
AI
health.
everything.
Mental health.
That's draining as hell too.
Yeah, but here we go. At the end of the day,
because I dealt in that too.
That's who?
I dealt with that as well. I was a worker in that as well. But it was rewarding. But
it's rewarding. But see, and the thing of mental health is this: you have to know you can't fix them. But more importantly, you can understand them. You understand what I'm saying? And sometimes it's that balance of you giving something back. As far as like being a nurse, that's the hard part. Somebody go die. You understand what I'm saying? And you have more people dying in the hospital than you actually dying, like, in mental health. You can help them have good days. You see what I'm saying? But most importantly, you're giving a part of you. Because like we talked last week, a lot of people have similar stories. They just don't have nobody to talk to.
You don't think that we deal with mental health in nursing?
No, I know you do. But what I'm saying, but what I'm saying, you said that it was stressful too. Every job we work in nowadays is stressful. But he asked what was a good field to go into. And the reason why I said mental health is because you can set your own schedule. If you're doing the right thing.
You mean like being a psychiatrist or something?
No, a psychiatrist is gravy. That's the best. That's like the doctor.
Top tier,
Sitting at
yeah.
the top. But what I'm talking about is people like case managers. You understand what I'm saying? That just go visit kids 2-3 times a week for about an hour.
That's so rough.
You understand what I'm saying? It's rough because you're dealing with somebody else's child.
And they live in situation they can't get right. You know, like it used to mean like social work and stuff like that.
All of it is basically the same. Yes, because that's what's paying now. You have more mental health patients than ever. So you always, just like in the medical field. When I started working, somebody gave me the best advice in the world. Get a teaching degree and go into the medical field. And you'll always have a job. You understand? It's always going to be people sick, and there's always going to be people that need to be educated. But most importantly, the new crave nowadays is mental health.
And it's so prevalent even more since COVID, and people don't even realize how we've changed in our mindset and everything, personality-wise, everything.
No,
And
they
it's
got
like,
mental health therapists getting paid $181,000 a year. You understand?
But see, just like she was talking about doing the pain management when Purple said ketamine. Now, I've only been familiar with people doing ketamine treatments for severe depression.
Right, psych wards, shit like that.
That is the most. Woo.
Wow.
But if you want
special case,
you want a career that's less stressful, figure out 6 of them numbers. Let's hit this Mega Million and go. No, about fucking business, bro.
Now you talking. But
this is a real question, though, real quick. It's more. I mean, this is a real question right here. Having nothing to do, retirement. Let's get there. When you get to the point where you retire, and it's like you work harder when you retire than you did before you, because everybody around you feel like you ain't got shit to do. So you can do everything for their ass.
So they calling you left and right.
You know it.
Oh, man, this dude hit on a whole other topic.
I'm just saying, when you start talking,
some people be loving it.
Look, let's go all the way to the end of that motherfucker.
What about that little? Okay, this on topic, but it's a sidebar. That little retirement community down in Florida.
Hold on, Lynn, before you even go there. Hey, Mr. Davis, you retired. You ain't doing nothing. Go on, do what the people ask you to do. You even retired. Do what they ask.
Nigga, as long as you pay bills, you ain't never retired.
Go ahead, Lynn.
I was just saying that retirement end part. Some of them people like that be going to that moving down to Florida to the villages, the highest STD capital. I said, what?
Yeah, but them people got money though. You know, ain't a lot of us down there. That's all I can say. Ain't a lot of us down there.
True.
Hey, if anything, they over at McGregor.
I feel like, oh no.
They over at McGregor in East Cleveland.
I feel they gonna keep on raising the age of retirement.
Yeah,
I feel like they're gonna keep on raising the age for retirement and Social Security.
Yeah, yes, you hit it. Right on. I think they try to push it up to
65,
67.
Oh my God!
Hey, because watch this. Because they realized first they had it when the average black man was living to 70 years old. So now they get that motherfucker a couple dollars before he check out.
Where did the money go when you don't make it? Huh?
I gotta remember. I gotta set an alarm for next time because I'm always coming in late, mixing all the good stuff. But I'm glad it ain't chaotic this time. That's all.
That's because he found a more reserved topic that a lot of people can. A lot of people can really understand. When you start,
do the
when you start sitting there talking about somebody's livelihood and how they feel, we got a problem on this, boy.
Well, I appreciate. We wanted to do some education tonight, and I'm sure it's a lot of people who watch it. They got good insight from y'all because, man, that's something really good to know about the medical field. Because a lot of people, we don't talk about that in the black community as far as when you're an STNA, RN, a doctor, or whatever. How stressful it is, what entails, what
and a journey to get there to be all the way there too.
Yeah, your duties and stuff like that. I hear people talk about it all the time, and I be like, man. That feel it because everybody always glamorize it, but man, when I hear people that's in it, they like, man, I'm tired. Like Purple said, man, it burns you out. And I always thought people.
I'll be coming home when I get off work. I pray to the Lord that I can make it because I'll be falling asleep driving. I'm so
yeah. See, so
might even get your Uber driver.
Oh,
That's seven.
dang.
They be charging. You know, they be charging crazy for certain days. Somebody who got to work doing the Uber, they paid $70, and they got there and they said, "We overstaffed. You got to go home."
Ooh,
We
peak
deal with
time.
that type stuff too.
You got to hit a peak time. But I'm good.
Better get you a friend with a car. God damn it.
Well, I'm glad y'all can come tonight and tune in next week. Like, subscribe, and share. Tune in next week, 8 o'clock.
Hey, you know I can get some stuff. We'll do something about coming on here with these towels on our head and
Well, listen, I just jumped out the shower. I had to wash my locks. I'm sorry. I had to wash my hair and I forgot. I'm like, oh my God, I forgot about the podcast.
Yeah, you know I'm just playing.
Now you look cool. You look like a gypsy. Ain't nothing wrong with that.
A gypsy?
Yeah.
Oh,
gypsy.
damn.
A black gypsy. There is a such thing as black gypsy.
I was like, I'm gonna be on the World Wide Web. I said, fuck it.
If you ain't, we got one now.
Hey, go tell her what you tell everybody. 100,000 people saying this shit right here. That's all.
It's somebody in the house looking like me right now.
That's right. They like, girl, go and twist it one more time. You look good. But tune in next week. Clips Podcast. Even look, we don't always argue. We even do educate. Mr. Davis can even educate y'all.
Oh,
He ain't
wow,
always
Mr. Davis,
controversial.
yeah.
So they be thinking he just feisty, but he got a lot of knowledge.
First of all, he ain't none of that stuff. I was the moderator last week. That's all I'm saying. Last week I kept.
Y'all tried. I watched that boy. I said.
And you thought I was the bad one?
Yeah, you always the bad one. So y'all tune in next week and see if Mr. Davis gonna be a nice guy.
Man, I don't even want to stay for that. I ain't
gonna and y'all tune in. All right, thanks. I appreciate y'all watching. And we'll get it together next week. But I appreciate y'all. Education night tonight. So if anybody want to go into the medical field, make sure you know which avenue you want to go in. It can be rough once you get in and do stuff that you done went to school. You done went to school. You done spent all this money. You got all these student loans. And then you turn around like, I'm not doing this. So make sure that's what you want to do. So you won't be caught up with all this debt. With that being said, tune in next week. Clips Podcast. Peace and love.